Welcome to the comprehensive guide to psoriasis, a condition that affects millions worldwide, causing skin inflammation and discomfort. Psoriasis isn't just a skin issue, it can impact your overall well-being, from physical health to emotional resilience. Understanding psoriasis involves exploring its various types, such as scalp psoriasis and psoriatic arthritis, each presenting unique challenges and treatment approaches. Whether you're newly diagnosed or seeking deeper insights, join us on a journey to understand psoriasis and empower yourself with knowledge. Psoriasis is a chronic skin disease characterized by red, itchy, and scaly patches that commonly appear on areas like the knees, elbows, trunk, and scalp. It's a condition that doesn't have a cure yet and can cause discomfort, disrupt sleep patterns, and make concentration difficult. Psoriasis tends to cycle through periods of flare-ups, where symptoms worsen for weeks or months, followed by periods of remission when symptoms improve. For individuals with a genetic predisposition to psoriasis, certain triggers can exacerbate symptoms. These triggers include infections, skin injuries like cuts or burns, and specific medications. When these triggers interact with genetic factors, they can provoke the immune system to accelerate skin cell production, leading to the characteristic rash and patches associated with psoriasis. While there is no definitive cure, various treatments are available to help manage symptoms and reduce discomfort. These treatments can include topical creams, oral medications, phototherapy, light therapy, and in severe cases, systemic medications. In addition to medical treatments, lifestyle adjustments and coping strategies are essential for improving quality of life with psoriasis. These may involve adopting a skin-friendly diet, managing stress levels, and avoiding triggers that can worsen symptoms. Common signs and symptoms of psoriasis can include patchy rashes that can vary greatly in appearance from person to person, ranging from small, dandruff-like scales to extensive eruptions covering large areas of the body. The appearance of rashes can differ in color depending on skin tone, appearing as shades of purple with gray scales on darker skin tones, and as pink or red with silver scales on lighter skin tones. Small scaling spots are often observed in children. Skin may become dry, cracked, and prone to bleeding. Symptoms such as itching, burning sensations, or soreness may occur. Psoriasis typically exhibits cyclic patterns, with rashes flaring up for a few weeks or months before subsiding. There are several types of psoriasis, each with unique signs and symptoms. Plaque psoriasis. This is the most common type, characterized by dry, itchy, raised patches of skin covered with scales, plaques. These can vary in number and typically appear on elbows, knees, lower back, and scalp. The patches may change color temporarily after healing, especially on brown or black skin. Nail psoriasis. This type affects fingernails and toenails, causing pitting, abnormal nail growth, and discoloration. Severe cases may lead to the nails loosening or separating from the nail bed, onycholysis, or even crumbling. Guttate psoriasis. Common in young adults and children, guttate psoriasis is often triggered by bacterial infections like strep throat. It presents as small, drop-shaped scaling spots on the trunk, arms, or legs. Inverse psoriasis. Found in skin folds such as the groin, buttocks, and breasts, inverse psoriasis appears as smooth patches of inflamed skin that worsen with friction and sweating. Fungal infections can trigger this type. Pustular psoriasis, a rare type characterized by pus-filled blisters in well-defined patches or on small areas of the palms or soles. Erythrodermic psoriasis, the least common and most severe type. Erythrodermic psoriasis covers the entire body with a peeling rash that can intensely itch or burn. It can be acute, short-lived, or chronic, long-lasting. Psoriatic arthritis is a condition where psoriasis and joint inflammation, arthritis, occur together. In over 80% of cases, individuals develop psoriatic arthritis about 12 years after first experiencing psoriasis. Nail changes are also common, affecting about 90% of people with this condition. Symptoms of psoriatic arthritis include painful and stiff joints that are particularly worse in the morning and after periods of rest, swelling resembling sausages in the fingers and toes, warm, discolored joints. While there's no cure for psoriatic arthritis, treatments can help manage inflammation, pain, and disability. Options include medications. NSAIDs can reduce pain and inflammation for milder cases. Conventional DMARDs slow down disease progression and protect joints and tissues. Biologic agents target different parts of the immune system. Targeted synthetic DMARDs may be used if other treatments aren't effective. Newer oral drugs. Drugs like apremilast, Otezla, and deucravacitinib, Sodiq-2, reduce inflammation and are suitable for those with mild to moderate psoriatic arthritis who can't use DMARDs or biologics. Scalp psoriasis is a common skin condition characterized by raised reddish patches with white scales on lighter skin tones, or purple patches with gray scales on darker skin tones. It can appear as single or multiple patches and may extend to areas like the forehead, neck, and behind the ears. This condition isn't contagious and likely stems from an immune system dysfunction causing rapid skin cell growth. About half of Americans with psoriasis, totaling around 7.5 million people, experience it on their scalp. While scalp psoriasis can be mild with minimal symptoms, it can also be severe, leading to thick, crusted sores and intense itching that disrupts daily life and sleep. Excessive scratching may cause temporary hair loss, although hair typically regrows once the condition improves. Symptoms range from fine scaling and dandruff-like flaking in mild cases to red bumpy patches with silvery white scales, dryness, itching, burning, soreness, and hair loss in more severe instances. While scalp psoriasis itself doesn't directly cause hair loss, vigorous scratching or harsh treatments can contribute to temporary hair shedding. It's essential to consult a doctor or dermatologist if you experience these symptoms. They can diagnose scalp psoriasis through visual examination or skin biopsy, ruling out similar conditions like seborrheic dermatitis. Treatment options aim to manage symptoms effectively while minimizing discomfort and potential complications. Treating scalp psoriasis can be challenging, but there are various options available to alleviate itching and reduce flakes. From over-the-counter shampoos and topical treatments to light therapy, oral medications, and biologics, there's a range of treatments to explore. 4 types of scalp psoriasis treatments. Over-the-counter products. For mild scalp psoriasis, over-the-counter products can help manage symptoms. Look for ingredients like salicylic acid, which softens plaques and removes scales, or tar, coal, or pine wood, which slows skin cell growth and reduces inflammation, itching, and scaling. Products recognized by the National Psoriasis Foundation's Seal of Recognition ensure they are safe and non-irritating for psoriasis patients. Topical treatments, medicated psoriasis shampoos, topical steroids, and prescription topicals are effective but can be challenging to apply due to hair obstruction. Discuss your hair care routine with a dermatologist to determine the best topical treatment for you. Phototherapy. Light therapy. Phototherapy utilizes ultraviolet UV light to slow down skin cell growth. Special handheld devices with built-in combs help direct UV rays to the scalp, making this treatment option feasible for scalp psoriasis. Systemic treatments. If scalp psoriasis is severe or resistant to other treatments, oral medications and biologics may be prescribed. These systemic treatments are beneficial for managing psoriasis on other body areas as well. Finding the most effective treatment often involves trial and error, as responses to treatments vary among individuals. Combining and rotating treatments may be necessary to achieve optimal results and manage potential side effects effectively. Consulting with a dermatologist ensures personalized treatment decisions tailored to your specific scalp psoriasis needs. Psoriasis. Steroids. Topical corticosteroids are widely used to treat inflammatory skin conditions like eczema and psoriasis, providing relief by suppressing inflammation. However, they do not cure these conditions, and stopping their use can sometimes lead to a rebound effect where symptoms worsen temporarily. These steroids come in various strengths: mild, moderate, potent, and very potent, depending on the severity of the condition and individual factors. The strength chosen by doctors correlates with the risk of side effects, which increase with stronger steroids and prolonged use. Areas like the face, genitals, and skin folds absorb more steroids, making side effects more likely in these regions. Doctors may prescribe pulsing treatment cycles, where steroids are used for 4 weeks, followed by a rest period to allow the skin to recover. This approach minimizes side effects while maintaining effectiveness. Children are typically prescribed milder steroids to avoid potential growth issues and cosmetic changes. In cases like scalp psoriasis, more potent steroid forms like gels, foams, and shampoos are used due to the thicker skin and scales. However, caution is needed as potent steroids can cause adverse effects if used continuously. Combining steroids with other therapies, such as vitamin D preparations or antibiotics for infections, can enhance effectiveness while managing potential side effects. Systemic or very potent steroids are reserved for severe cases and are closely monitored by specialists due to their strong effects and potential for rebound reactions when discontinued. Special care is also taken with allergic reactions or reduced drug effectiveness, tachyphylaxis, often requiring changes to treatment plans. In conclusion, navigating psoriasis involves understanding its diverse manifestations and impact on daily life. From the common skin patches to the complexities of psoriatic arthritis and scalp psoriasis, each variant presents unique challenges. While psoriasis has no cure, managing symptoms is feasible through various treatments such as topical therapies, phototherapy, and systemic medications. Lifestyle adjustments and coping strategies also play pivotal roles in enhancing quality of life. Empower yourself with knowledge and seek guidance from healthcare professionals to tailor treatments to your specific needs. By staying informed and proactive, you can effectively manage psoriasis and improve overall well-being.